how do you do well in these cognitive exams? So the UCAT or the BMAT, how can someone prepare well for these exams?
There's a very easy answer, and well, not an easy answer, sorry. There's a nice answer and a not nice answer. Um, the not nice answer is you really can't advance past a certain point because it is so time constricting, and there's just so many things going on at once. There's obviously the pressure of trying to getting into med school. There's the exam itself, that even if you practice, even if you do every single past paper or every single question there's a certain ceiling that you'd reach. And that's obviously, you know, not a nice thing to think about. But the way to best prepare yourself is just to do every single question that you can get your hands on. The best websites to do these questions are Medic Portal or Medify. Those have great question banks and practice papers and all sorts of different statistics that you can look at to sort of focus your learning into one area. But it's so important that you practice because it is such a niche thing that you have to do within these cognitive ability exams. It's like basically nothing else in the world. And it's so important that you just get used to seeing a range of different questions. So I would say the break between year 12 and year 12 and 13 is when you should be focusing on doing the UCAT or the BMAT. So I spent basically my entire summer between year 12 and 13 just doing UCAT questions, not going out or I obviously did, it's summer, I did rest up a lot, but that was my sole focus for the entire summer, was to just improve my UCAT score as much as I can, because the UCAT really is that important because it's used as a cutoff. So if you're 10 points off, because the UCAT scored in point to 10 for anywhere from 1,600 to 3,600 points. So even if you're off by 10, which is the difference in one question, well, it's a cutoff. We're sorry, we can't consider application. So that's why the UCAT is such a vital part of your application, and it's so important that you start early. The summer between year 12 and 13, because by that time you've already decided that you're applying for med school. And if you have decided, there's nothing else you should be doing. A levels, you can put them down for now. Extracurriculars, yeah, they can wait. All these different things. You know what? I'll hang out with my friends once I get into med school. Just focus on your UCAT and your BMAT. It's that important.